The majority of human beings are now living in urban areas. This trend will continue, with 6 in 10 people living in towns and cities by the year 2030. More people are migrating permanently to urban areas. However, looking beyond the attraction of imposing skyscrapers and big city lights, today's cities often put human health at risk. The urban poor are most affected by the health hazards of urban life and often suffer from lack of access to healthcare services and a wide range of communicable and non-communicable diseases. The urban rich are also affected by a sedentary lifestyle, leading to health problems such as obesity, diabetes, and cardiovascular diseases. Both rich and poor are subject to stress and psychosocial problems in the cities.
Urban health across the WHO Eastern Mediterranean region is increasingly challenging. Unplanned urban growth puts populations at increasing risk of poor quality of life, poor health coverage, poor infrastructure and sanitation, and unsafe drinking water. Urban populations are also more vulnerable to disasters and are at higher risk of communicable and non-communicable diseases like heart disease, diabetes, and cancer. They are more vulnerable to injuries and early death than rural populations.
To address the ever-increasing concerns about urban health, the World Health Organization has developed a health promotion initiative known as Healthy Cities Project. A healthy city is one that is continually creating and improving the physical and social environments and strengthening those community resources which enable people to mutually support each other in performing all the functions of life and achieving their maximum potential. Healthy city projects have 6 characteristics in common: commitment to health, political decision-making, intersectoral action, community participation, innovation, and healthy public policy. Healthy cities projects, through intersectoral action, facilitate a process through which organizations working outside the health sector change their activities to contribute more to public health. There are many examples of healthy cities projects where abandoned old factories were converted into recreational facilities, or unhealthy garbage piles transformed into community waste management centers. Healthy cities projects are based on the philosophy that the roots of ill health lie in social and economic factors.
People who live in urban slums and disadvantaged areas are in a particularly vulnerable situation and often have little access to social services, including health. Over 1/3 of the world's urban population lives in such areas. Health equity and social justice in provision of basic services have become now the guiding principles for sustainable development initiatives. The importance of health equity has been emphasized by the member states of WHO in the Rio Political Declaration on the Social Determinants of Health, which was adopted by the World Health Assembly at its 65th session in May 2012.
Healthy cities projects recognize and address many social determinants of health and place action related to them at the center of its agenda. Education, women's engagement, empowerment, housing, and income generation are among many healthy city initiatives.
In response to the urban health challenges in the region, the WHO Regional Office for the Eastern Mediterranean is supporting city planners in their efforts to strengthen intersectoral collaboration, assess health and social inequity, and take appropriate action under the umbrella of the WHO Healthy City Program. A regional Healthy City network has been established with an interactive website that encourages city planners to increase the access of city dwellers to quality health, environmental, social and cultural services, advocate for effective partnership, community participation, and intersectoral action in local health planning and management, and learn from each other through sharing good practices, experiences, and challenges, and take action to meet the WHO criteria for designation as a healthy city. I strongly urge city planners and authorities to join the Healthy City Network and to register their cities in the website. Since its initiation by WHO in 1986, the Healthy City program has inspired many city planners, globally and regionally, to make our cities healthier places in which to live. As the pace of urbanization accelerates, we need more than ever to make every city a healthy city.